Alright, Oscar, Dr. Johnson, thanks for coming today. So we're going to check out your abdominals. What I'm going to have you first, I'm just going to check your stomach, check for any tattoos. I like your tattoo, it's a nice one. I'll check for any abnormal hair or any kind of skin discolorations or bruising or anything that can, abnormal. Next, what I'm going to do first is I'm going to auscultate your heart, or not your heart, your bowel sounds and your abdominal aortic sounds. So first I'm going to do bowel sounds. I'm going to start clockwise. So lower,
like some
right quadrant.
Anti-rape porn or something.
Actually, I'm going to have you turn your head to the left and then just cough on me. And then any pain with that?
No.
Okay. Just making sure there's no any kind of mass or any kind of herniation before we start the exam. Right. And you can just breathe normally. What I'm checking for is hyperactive bowel sounds or hypoactive bowel sounds. And when was the last time you ate?
Hour ago.
Okay. Yeah, I can hear it's pretty loud. So definitely some churning going on. And I'll just check each of the 4 quadrants. And next, I'm going to check for Bruy sign, for the renal arteries, abdominal aorta, umbilical artery, iliac, and femoral. So first I'm going to start with right above the umbilicus, one each. We're going to use the bell. And I'm just looking for any kind of swishing, which would indicate an aneurysm. And I'll check the renals, so inch lateral, inch superior. Check the common iliac, which is in between the ASIS and the umbilical cord, or umbilicus. Then I'm just going to pull down your bicep just a little bit, just to get to the femoral artery. That's okay. And everything seems normal. Next, what I'm going to do is I'm going to percuss the abdominal area. So first I'm going to do the axillary area, and we'll start at nipple and listening for different sounds.
I'm going to percuss that
And then his liver would be right here, so I want to find his liver, see where it stops. So start in the chest.
There you go.
And his liver ends right about here, right at the end of the rib cage.
God, 6 and 6. You've gotten 1 and 6 in the last 7 games. Yeah, we're all of a sudden one of the worst teams in the world. I mean, we put up a fucking hell of a fight. We should rob.
And then
it's so shitty that our games seem to come down here as 1 or 2 plays.
So all sounds pretty normal. Next I'm going to do is I'm going to measure the liver, so we're at first here, superiorly, and then be right about here, and then I'll start down here and percuss towards the liver. And right about here, so that's around probably 6 inches, 6-7 inches, which is normal. 6 to 12 is normal. Next, I'm going to check the spleen. So what I'm going to do is I'm just going to have you relax there. I'm going to percuss it, see what it sounds like. So then I'm going to have you breathe in.
Yeah.
Inhale.
Skip forward.
There you go.
Or skip back.
I'm just checking for any dullness, meaning that the spleen has enlarged.
But the play thing will still be there.
Next, we're going to do kidney palpation. Oh, let's do umbilicus. So what I'm going to do is I'm going to check for appendicitis. So what I'll do is I'll find the umbilicus and the ASIS, and halfway would be the McBurney's point, and that's where the umbilicus lays. So what I'll do is, if the patient has no symptoms, I'd start lower right, push. What I'm doing is retracting the mesentery to see if it makes any pain in the umbilical area. I'm also gonna, and if the patient did have a mass when they cough, I would also palpate that mass area, and I would feel if when they bear down. So can you bear down for me? So I found that mass, and it went more posterior, then it would be a intramural mass, and then if it went towards anterior, then it would be a intramural, and abdominal would go more posterior. Okay, and then so I would just check the abdomen for any kind of masses or cysts I can feel up there. I'd also go deeper, check for any kind of pain, any kind of deeper masses. No pain with that. Alright, and what we're going to do next is I'm going to palpate the kidneys. So I'll find the kidney, or left kidney, and then with my other hand I'll press down. Mostly you're not supposed to be able to feel it unless it's enlarged. Same with the spleen. Do the same. I don't feel anything, which is good. Check the other side. No pain here for the appendicitis or kidney. Next, I'm going to check the width of the abdominal aorta, so I'll just find his pulsation here. I can feel it pretty good here. What I'll do is I'll just outline it with my fingers. This should be within 3 centimeters, which is so it's normal. Alright, what I'm going to have you do is, I'm just going to lift your leg for special tests, and I'm going to internally and externally rotate his hip. Passively. And any pain with that? No. This would also indicate appendicitis. Alright, and I'm going to have you turn that wall here on your side. And then what I'm going to have you do is, I'm just going to stabilize your hip, and you're going to bring this right leg straight back. Go ahead. And any pain with that?
No.
So that would indicate tightening up on the appendicitis. And that's it for today. Thanks, Oscar.